practical measures. And so the CARTA ordinance is the first thing we're going to talk about, and some modifications that will help us streamline and be a little bit more organized. And I'm going to go through them very briefly with you one by one and take any questions before we go on.
Let me just, for those, I think, so it's on next week's proposed agenda under city attorney's office.
Yes, sir.
All of the ordinances there that's listed will refer to what Charles is talking about.
Thank you, sir. And as you can see up here, the first reading will be Tuesday, October 8th. The second reading planned currently for Tuesday, October 15th. The first change is 23.2B. It's the minimum number of board members. Currently, we have a minimum of 10. We wanted to reduce that to 7. This would be through attrition only. We're not looking to rid anybody, but we did want to change that minimum threshold. It does not prevent us from having 9, 10, 11, 12 should we want to. I know we had some conversation that in the future perhaps there's a representative from each council district, which we would love to entertain. But in the meantime, we want to just change that minimum threshold so nothing, no one leaves the board in the meantime. Second, 23.2B, the board member term. So we would like to change the board member term from 5 to 3 years. This would only be for new appointments. None of the appointments that you made in 2023 would be impacted by this. And then secondly, add a term limit of 2 consecutive terms. Again, this would be only for new board appointments, not any of the appointments that you made in 2023. And then continuing on, 23.3B, a minimum number of meetings. Today we have a minimum requirement of 1 meeting per month for our full board meeting. We want to change that to 6 annually. In reality, we'll end up having 8 to 10 meetings, but we just want to change that minimum threshold down. We will continue on with all of our monthly committee meetings. Those are different than our monthly business meetings. The next one on the list comes to bring our board in alignment with all of the other city boards. We want to change the compensation from $50 per meeting for our board members to 0. So this will be consistent with all of the other boards as well. And then finally, the last 23.18, this is a modification to the language that had not been updated to reflect that passenger vehicles for hire are addressed under Chapter 35. So that's not a CARTA requirement. We just want to clean that up. And so with that, I would just pause for a moment for any questions that you had in this area.
Thank you, Charles. I've got a couple of questions. So related to 23.2B, the board member term, I understand not changing the current appointee's term from 5 to 3, because this is not an effort to change the makeup of the board, but just for moving forward. But why would the consecutive term limit not apply to all board members?
I think the answer is it could. What we wanted to do was be very respectful of the people that the council had already appointed, and at that time there were no term limits included, so we wanted to just have a legacy standing for those folks. Could be changed if we felt strongly about it.
I know that we had quite a lot of change on the CARTA board in the last 2 years. I'll be interested to hear what my colleagues think about that. The other thing is the compensation for board members. You didn't mention if that was for new appointments only, so I assume that that is retroactive for the entire board.
This would be retroactive for the entire board.
Which to me kind of makes like the term limit sort of similar in terms of being retroactive. So,
Understand.
I'm open to the term limits going just for everybody, just to keep it simple for you all, given that you have a full board right now that could stay forever.
True.
You know, if they wanted to, and the appointments continued. That's all. Thank you.
All right. Anybody else? Questions? Okay.
Okay. Moving on, the second item is the parking ordinance and the modifications. I'll go through these as well. So again, the first reading for this will be Tuesday, October 8th. The second reading planned for Tuesday, October 15th. The first thing we're talking about, section 24505, we want to expand the paid parking boundary. It's a rather minor expansion. On Cherokee Boulevard, 27 spaces, and I just lit up on the map there, circled the two areas. The red is a little difficult to see. So 27 spaces along Cherokee Boulevard, and then an additional 24 spaces along Spears and Velma. The why, we want to encourage turnover of the premium spaces that are there for the restaurants and merchants that are along these areas. And then ultimately, we would see some increased revenue for the shuttle program as well. The North Shore Shuttle does not currently have the same frequency as the downtown shuttle, and we'd like to start putting some additional funding aside for that. And then when this would happen, really it would happen late spring or summer 2025, and we'd really want to coordinate closely not only with Vice Chair Hill. We've already agreed to come and talk to any neighborhood associations that would be interested, but we would coordinate very closely with CDOT as we do for all of our paid parking spaces. And so happy to take any questions that you might have for these changes on here before I go to the fines.
I'm good on those. I talked to the neighborhood association about it.
Fantastic, yeah, this is in District 1, so.
Yeah.
Thank you. Moving on, the next is changing on-street fines. And so 3 changes. The first is to approve a base change of the ticket. It's currently $11. We want to change that to $20. $16 if it's paid within 48 hours. So this is section 24.326. And just as a reminder, what we do see that happens here is people do sometimes take the ticket for $11 because it's less expensive than paying the hourly rate throughout the day. So we want to disincentivize that and discourage illegal parking to further drive economic impact in these valuable spaces that are in front of merchants and restaurants. The second is to change the illegal parking from $36 to $45, which is section 24.302. And then finally, approve the change of disabled parking violations from $50 to $100. This is 24.302. All of this is to discourage illegal parking, further drive economic impact, and I did include the peer cities for comparison for all of those for your consideration there, but I'd be happy to take any questions that you might have in this section as well.
We'll have to look at that regarding the Tennessee statute, whether there's a problem.
Sure. Yes, thank you for that. If you'd like to just explain for the
Yeah, I
third
mean,
item.
the normal authority for municipal court is $50 per incident on here, so we gotta be careful about whether that's a violation of the current municipal court statute.
We'll work through that this week, and
Sure.
it'll be
That's the only thing I saw at all.
cleaned up before the first reading next Tuesday.
Sure.
That would only apply to the disabled parking then?
Correct,
Correct.
that's the only one.
All right, if no other questions, I did want to just remind you that this is tactical moves as part of my leadership. I do plan to always remind you of the vision that we're building to, the mobility ecosystem. I'll try to remind you when I'm making tactical recommendations such as these. And appreciate your time today. I could answer any follow-on questions that you might have.
On the, sorry, I did that, but
Yeah.
you were looking down, and then
Yeah.
Charles was looking up, so apologize. So on our strategic planning agenda, it says parking changes Fraser, but I don't see anything about Fraser on this presentation. Is there anything?
Oh,
we
me,
have?
me, me, Fraser. Charles Fraser.
Welcome, that's true, okay. You know I got Fraser on my mind all the time.
I'm glad.
Okay, thank you.
That's one of my favorite restaurants. Is that. I go in there and I asked them if they get a discount, and then no, there's no discount allowed. If no other questions,
Thank you.
thank you very much.
And I'll be in touch with Rachel.
Appreciate you.
All right.
Jermaine, I think he was gonna introduce the agencies. Yeah. Well, I think one of them's the YNC, the YCAP, correct?
Yeah.
Well, come on,
Come on, Mike.
we don't need Jermaine to introduce you. You introduce yourself and tell us what you're doing with our money.
You want me to sit or stand? What's best?
Sit down. Stay a while.
My name's Andy Smith. I'm the Regional Executive Director for the YMCA YCAP program. Some familiar faces in the room. Some of you have been to our facility and tied in closely, and so it's an honor to come talk to you just real quick. I like to tell people, I'll talk fast if you listen fast. I don't know if I sent a PowerPoint presentation.
Let me see if I can connect my computer. We have a right here.
There it is.
Tell them we don't need him,
That's okay.
Chris.
If you want to do through to,
See if it.
Yeah.
Okay. We, YCAP, we are a YMCA, program. We started in 1998.
Hold on, let's get that on the screen before he gets going.
It's, yeah, he's, we got a hammer out in the truck if that doesn't work.
is it my computer? Let's try another.
I have my high heel down here, so.
That works too.
Show me your computer on, let's try. Because you have these great pictures. We want to show these off.
Yeah, we want to.
Let's try this. We'll try this other laptop real quick.
No, I think it's,
Maybe not right this second.
That's what
but
I'm
in a
saying.
second, you'll-
not right now.
Ah, yay, okay.
L, yes.
Yeah, you can start there.
You got it.
Okay. So again, thank you all for letting us do this real quick, but we are celebrating our 26th year. Started over in 98 over in a little storefront building in North Chattanooga, and just been blessed over the years to not only sustain but continue to grow, specifically here in the Chattanooga area. And as a lot of you may or may not know, we're in the old number 7 Fire Hall building on Central Avenue. That building's been around for a long time, best we can tell. But we were able to expand through the mayor's initiative with the ARP funding. Last year, we realized the need in the Brainerd area, specifically Woodmore, Dalewood, and even some kids that live in the city but go to Eastridge Elementary. And so we launched this initiative last January, and you can see the schools that we're currently serving. A little background on how it works. These kids are referred to us. So some of them juvenile court, some of them principals, guidance counselors, teachers. But in a sentence, early intervention prevention. These are kids that maybe were picked out by those different places and sent to us to come up with a plan to help them, whether academically or behaviorally, and even working on closing some gaps in their education. Year to date, we've served 62 kids from the start, from where we started last January, and supported over 50 families. And when we talk about serving kids, what we look at is we program 4 days a week, and you'll see it in just a second. But we judge those days that we served on a minimum of 30 days. So in other words, we want to have them at least 2 months, 4 days a week throughout the month, and we judge that success based on a 30-day window. Are their grades improving? Are they staying out of trouble? Are they getting any more juvenile referrals? Are they getting suspended from school? So that's kind of how we judge those successes. Our daily schedule, we pick them up Monday through Thursday, and we have them, as you can see, from the time they're out of school until 6 p.m. And just shy of them being sick and not at school, we require them to be with us. We have vehicles that our staff goes out and picks them up. We spend 1 hour on homework and tutoring, and then we spend 1 hour on some kind of programmatic activity that you'll see in just a few minutes, and that ranges from sports to arts to swim lessons to anything that we can offer those kids to get them involved in some kind of activity. We spend 30 minutes in group therapy where we get them to talk about the issues that they're struggling with at home, and then they realize that their buddy that they go to school with next to them may be struggling with the same thing, and they learn how to cope together. And then every day at 5:30, we have volunteers all throughout this community that are maybe on a once a month or a every other week rotation that bring a meat and three. So we finish out our day every day by feeding them a dinner. So just another place for our volunteers to get involved. Some of the things that we do, and some of you have heard of the boxing program, and that is one of the things that we do offer, but we realize not all kids want to box, and that's okay. So we offer some other things. We have a volunteer that comes twice a week that does tennis. As you know, at the Brainerd Rec Center, there are tennis courts out there, and so it's very accessible for our kids to go out there and get involved in tennis. We have swim lessons. They actually go to the Hamilton YMCA twice a week, and they're doing swim lessons. We want to make sure that every kid gets the opportunity to learn how to swim. And then we have several different creative arts that we have, once again, volunteer driven by folks in the community that have come and said, how can I get involved? And so we try to match their talent to what our kids' needs are. So that's kind of the activities. You can see the academic performance. You know, we put a lot of emphasis on academics. Our staff during the daytime actually go into the schools. They're sitting with them in class. They're going to IEP meetings. And so instead of, you know, a school suspending a child, they'll call our staff, and our staff will go and, you know, help diffuse the situation. So let's don't suspend them. Let's do everything we can to keep them in school. And so it's an honor to have our staff being able to sit in class with them and network with those teachers and principals to make sure that we're not missing anything out in terms of academics. Kind of the last piece of this, we do make it mandatory that once a month all of our families come to a family night, and we try to make sure that any hurdles that may arise with that. Sometimes parents have to babysit kids or whatever, and we say, well, bring the whole family. And so this photo was from last Thursday night at the Family Justice Center. We had 76 folks come to our family night. Currently in the program right now, we have 19 students, and we're really at max capacity based on the space that we have out at the rec center. But that's kind of who we are and what we do.
What happens at family night?
So we have different speakers that come in and will either share testimonies or we'll do activities, and it just gives them an opportunity to all come together. And then our staff also shares with the families about what's going on day to day. And what we're offering throughout in the afternoons for programming.
So the slide previous said 98% of the students show improvement in the grades. Is that something that y'all can document and
Yes.
show improvement in?
We have access to all their Power School information, which is one of the ways that we document our successes. We're also using, you may or may not have heard, an online reading platform called Lexia.
Yeah.
And that actually documents extremely well and sends all the data right back to our staff so we can track that as well.
So that's one of the things that when we talk about impact, we don't really want to know how many students per se have been served, but what's the impact on those students, their grades going up. Councilwoman Burrs and then Councilman Hester.
What's the budget?
Man, better.
Huh?
Nothing.
Oh,
Ready?
I'm just messing.
Okay. What's the amount of money we give you?
300,000.
Okay. So I have to tell you, you don't know this, but I'm part of your program in 3 places. Very much with the Family Justice Center. So I teach sports aerobics at the Y, and I see at night, and I see your kids coming in with swimming and having the best time in the whole world. I think some of the impact can't be really measured, because how do you measure smiles? How do you measure having fun? How do you measure all of those things? So visually, I'm seeing, I of course would want the data from the grades. I think that's important. But I'm seeing it in action. And I also work very closely with the juvenile court and work with a lot of those kids. So that's the third leg. And I'm seeing you do a really, really good program. What's limiting you from serving more than 62 kids?
I think it's probably the same answer, space, resources, right? It takes money to continue to do the work that we do. And so for us, you know, we're really maximizing, again, the space that the city has given us out at the center. You know, we're confined really to 2 rooms when you think
At-
about it.
At Brainerd Rec?
Correct.
Okay.
And we're grateful for that, but it becomes a space issue, when you've got 18, 19 kids in, 2 little rooms,
Okay.
especially when it gets colder and darker earlier. Right now, it's okay, because we can be outside and all that, but, just space and financial resources.
Okay. Okay, thank you, well done.
Councilman Hester?
Just want to say thank you for what you guys do. Man, I've been over there at Chris Ramsey, see you guys in action. Those guys just light up when they're out there with you guys. And I think the change from a lot of those guys have traumatic experiences, and you guys give them, see it from a different perspective. And I guess it builds up it builds them up. And I think that is, in time, you can measure that, because they become, I guess, productive citizens. And one thing that I'm stressing literacy. And if the kids can read by a certain age, then chances are when we're building more prisons. So continue doing what you're doing. Thank you.
All right. Anybody else? Councilwoman Coonrod?
I know y'all probably saw that little cute little girl that was on the picture at the beginning of the slide. That's Peyton. But Peyton got introduced to YCAP actually by Dylan, because during the time that her father was killed due to violence, he said, Councilwoman, I think this will be a great program for her to be introduced to that can help her channel her emotions. And she was able to do that through the therapy sessions, and she was able to meet other kids that had experienced the same thing. But as Councilwoman Byrd said, how do we really measure the impact of smiles? And through Peyton, I witnessed her smiling all the time, her engagement. She began to open up more. She talking all the time. I would get calls like, oh, we can't keep Peyton quiet now. And she would be so excited, but other kids were exhibiting the same thing too. She learned how to swim. I'm not a swimmer, but she loves to swim now. Even though she's not participating in the program now because she's not in that school zone, she always get checkups from the staff there like, hey, how is Peyton doing? Or when they see her out in public, they always give her a warm hug. And sometimes to the point where she like holding on to the leg like, get my school, get my school. But it's been a great program, for any kid. I wish that we could really expand it out to, all our recreation centers, so kids can have that opportunity to be impacted in that way, because sometimes you would think that the parent got it all together, or the parent is the person who that kid can open up to, but it's really a struggle, because we don't understand how they're feeling at that age. But when you have other people and surrounding them with kids who've been impacted in violence, by violence such as Peyton had, it gives them an opportunity to really own their feelings amongst the peers of their age group.
I have one more question. So is your model that you're only at rec centers that have like a pool or tennis courts, or?
No,
Talk more about
our facility on Central Avenue, it's an old fire hall building.
Sure, I know,
So
I'm
we just
familiar
made the
with
best of it. It doesn't have a pool. The rec center came about when the ARP funding came along and we applied for it. The idea was to find kind of the best place for that fit, and we looked at a bunch of different places and just found that that was the best fit in that time, also with the schools and the needs in that area. So that's kind of how that particular area worked
Well,
out for us.
following up on my colleague's comments, if you were to say we want to expand, and we want to expand to whatever area, what would you be looking at? What would you be looking for?
Well, obviously space, is a need.
Well, let's say rec centers, let's say that. So would you be looking only for someplace that has a pool, only for someplace
No,
that has?
it doesn't have to have a pool. One thing being under the Y umbrella, we can go to any of the Ys downtown, Hamilton, whatever the whatever the closest
Okay.
YMCA is, and use those facilities.
So you would home base at whatever the center is, and then take them wherever.
Correct.
So then and if you got the spaces, the city could fill that need. So what you're really talking about is money
Correct.
for staff to
Correct.
expand, to do those things.
Yes.
That's what the ask is. Okay,
So did the ARP dollars funded staff members?
It funded a full site, staff, supplies, the whole site. What it didn't fund was we brought the vehicles, because we own the vehicles, and then there's a few supplies that we brought along with it, computers and that kind of stuff. But yeah, staff and overhead costs and supplies, yeah.
Not location or?
Correct.
Yeah, okay.
Correct.
No question. How can one volunteer?
I'll give you my cell number, call me. We take anybody. You know, looking for people to bring meals. You know, a lot of people can't come and tutor. That's okay. You can bring a meal once a month or come and tutor or.
Yeah, we're live. You can provide that number.
I've got your information. I'll shoot you an email.
Okay, all right.
All right, Andy, thank you.
Thank you.
All right. Chief, welcome.
Sorry I'm late.
Glad you could join us.
So sorry. Whose computer is this?
That's mine.
Okay, cool, then we're good.
Leave it there.
Yeah, that's fine. I'm gonna scroll back through here. Thank you, Andy. So, we were fortunate to be able to get Volunteer Behavioral Healthcare System to sub in for us. We had another agency that had received ARPA funding that had to cancel at the last minute. So kudos, on the front end to Volunteer Behavioral Health. But the initial award was for $175,000 for crisis counseling. And this sort of gives you a description of what the funds were used for. So salaries and benefits of 2 crisis intervention coordinator positions within the Erlanger Health System, with those crisis intervention coordinators working in close partnership with education staff to best ensure individuals who require crisis intervention will have immediate access to an assessment. So I think I have Missy Zinson here from Volunteer Behavioral Health. So I will let you take my seat and I'll switch. And
I'll sit wherever you tell me.
okay,
I'm good at following instructions.
okay. Well, let me get to your slides.
She can come here if she likes.
Well, because she probably wants to navigate through the slides,
Okay.
unless you want me to navigate for you.
You can navigate,
I'll navigate for you. Okay, sounds good. All right.
and I'll just come sit right here, is that okay?
Oh, yeah,
Thank you, ma'am.
absolutely.
Okay, sorry.
Oh, you're fine.
I'm a little klutzy, so.
That's okay. Join the crowd.
So my name is Missy Zenson. I'm with Volunteer Behavioral Health. I've worked primarily in crisis services. I've switched roles lately. I'm the Senior Director of Community Outreach and Liaison Services. So I was in charge of getting staffing and implementing the program through the ARPA grant. We always start with our slide, our mission. If we were to break it down completely, we really want to ensure that people's tomorrows are better by giving them help now. Okay. So why did we seek the funding? Why did we seek this out in the first place? Right about the time we received the funding, I think, COVID was still in swing. Us as the statewide crisis provider in 29 counties, including Hamilton, had lost a bunch of staff because staffing was low during that period of time. People weren't doing face-to-face assessments anymore for the health of everyone involved during the pandemic. And what happened is that the ERs became a place of high utilization for people with mental health problems waiting to get into the state psychiatric hospital. And seeing some of those problems, the lack of beds, and then also the lack of face-to-face that we could perform during that time, we saw the need to have somebody that we could actually get in there with the staff that's face-to-face. I'm kind of old school like that. It makes a difference if I can see your face and say, hey, what's going on, versus I'm going to pull you up on telehealth. So that's just what we did. We took one of our crisis workers, and ended up being 2, and we placed them in Erlanger's emergency room. This will make sense a little bit later, But what I want you to gather from this grant is that not only did we utilize your grant to fill those positions, but we've taken the concept and now we've expanded it. We've expanded it in the Hamilton County community, we've expanded it in Bradley County, and I'll explain more about that a little bit later. So the way that it worked was we were to place 2 crisis coordinators in the Erlanger ER. We started with master's level trained because that's ultimately what we wanted. After a short period of time, we realized we were not finding these master's level people that we wanted. And so I met with Erlanger and the ER director and said, would it be okay with you if we put bachelor's trained clinicians in there? And we did that because our crisis teams right now we have master's and bachelor's level clinicians that are supervised by licensed people that review their cases and help assist in determining level of care. So Erlanger was okay with that. I included them in the interview process. They got to interview Emily and Raven, and they've been happy ever since. Emily was the first one to fill that position. She has since gone on to fill the role of a behavioral health worker for Erlanger itself. Raven is still there, and she is still functioning that capacity. Yep. Just so you know, ask Jessica about Raven, and this is what she said. She's been an invaluable asset to the Erlanger psychiatry team. Her ability to complete assessments on site has significantly contributed to a reduction in the amount of time a patient experiencing a psychiatric emergency holds in the ER. While she's a volunteer employee, she's also a special part of our team. I think if you talked with anybody in the Erlanger system that's interacted with Raven, their biggest complaint is we want more of her. So for the time that we've had the grant, between Emily and Raven, they've done 548 crisis assessments. Raven currently covers all the Erlanger locations. She's physically present at Maine with the behavioral health staff, but if there's an issue at East, there's an issue in Sequatchie, any of the locations, she covers that with telehealth. When she can physically go, she'll go. I was asked to provide kind of a day-to-day, what does Raven do? Well, she checks in with the team. She does any crisis assessments that are assigned to her. She does follow-ups on the clients that she sees. And then she also assists the clinical staff there. So I'm not sure if you guys are aware of this part, but as one of the state crisis providers, anybody that's uninsured or has TennCare has to go through the crisis team to be able to go inpatient. So sometimes we have people that are at Erlanger that maybe we'd seen in the community, and maybe we gave them a report, but they need more information. Raven is there, and she can provide collateral information for purposes of continuity of care to make sure that client is getting an accurate assessment and the care that they need. So that's kind of what she does. Because of the positive outcomes from the program, it kind of encouraged further development on our part. You know, we were asking ourselves, what can we do as the crisis provider for this area to help our mentally ill clients get the treatment that they need? And so what we did is take the concept of a crisis worker and we added the skills and development of a case manager. So right now we have these individuals and we call them behavioral health liaisons at Erlanger, at Park Ridge, we have them at Bradley Medical. I'm just getting someone into Silverdale right now as an employee, not an inmate. Thought I should specify that. We've got one at the Chat Foundation, at Homeless Healthcare, and we're placing them in the health departments. And the consistent feedback that we're getting from the places is that we want them, we want more of them, we're appreciative of them, and I'm excited about the program. I think it's great, and it all started when we came here and said, hey, this is something that we're seeing a need, and you guys kind of got us on that path. Mm-hmm. So for that, I'm very appreciative. Go ahead. So what do our BHLs do? I like acronyms, I'm weird. But they do, they bridge the gap between clients and mental health services. They're helping others, they lead the way. They're in our communities, they're in our walk-in centers. When the crisis team's overloaded, I solicit the help of the BHLs. When the case managers are overloaded, then they help with case management. If the CSU needs help, they help there. I said they're my heroes, and they really are. I can't imagine anything greater than to be able to spend my day walking alongside people, waiting with people, linking them to services. To me, being able to go home at night and say, hey, I made a difference is huge. And a lot of people that get into social work and in mental health want that, right? We want to be impactful. I asked Raven to tell me like one of her success stories, and so she said that a few weeks ago I assessed a patient who had a suicide attempt overnight but was regretful of their decision. A psychiatrist had assessed them and recommended they go into voluntary inpatient, and if that did not work, then they would have to go involuntarily. The patient was uninsured, and we knew that they would have to wait to go to Moccasin Bend, but they didn't seem like a good fit for that facility. The patient was wanting to go voluntarily to the crisis stabilization unit, and if you don't know what that is, it's an on-site unit on Spring Street where people can get 3 to 5 days worth of inpatient type care, but it's all voluntary, low acuity, and it's free. It's grant funded, so nobody ever gets a bill. So the patient wanted to go voluntarily, and initially they weren't sure if the client would be able to get in because of injuries from the suicide attempt. So it's not a medical unit. We don't have the ability to do that. So somebody has to be stable enough to say, yes, I want to go, and yes, I can take care of myself. She said she was able to see them and make the referral to the crisis stabilization unit, and the patient ended up being accepted there, and the parents were very grateful of how things worked out. I will tell you, anytime I ask these individuals to help, they don't just help, they're excited to help. One of the other directors was like, hey, we need some help with this, and my employee was in there, and she's like, yes, and she was like, that is so odd, but they really love what they do, and they care about the clients, and they're involved in outreach. We have this thing called a BHL Blitz. I named it, maybe it's kind of corny, but it means we're all in, right? You know, like you're going after, we're all in, and we're all in together. And so we've done community outreach at the Chat Foundation, and all of this started with that little spark from your grant. So I am very, very, very appreciative, and I know the community's appreciative. So.
I'm just curious, all these, you gave us a job description of Raven and all these many tasks you go to Ray County, Squatchy, and all. How many hours you work a day?
Me or them?
Raven.
So Raven works a 40-hour work week.
40 hours, okay.
But she doesn't, we have more employees to help cover those places. Raven does do telehealth with some of those locations because there's only so much that she can do. And if there's an overwhelming amount of referrals, then she can pull in people from the crisis team to help as well.
Well, I'm thankful that you all have such a caring staff, because at any moment, any of us, even at this table, can be ready to flip over some tables. So it's great to have people who, you know, have the heart to serve in that capacity, because we know that it doesn't pay much. You know, so you gotta have the heart to really want to help and to go into the trenches to serve those individuals. And what we saw for mental health is during COVID, like it seemed like it just exploded. The Band-Aid came off. But that's the stigma around receiving help, around mental health, like it's gotten to a point now that where people are comfortable talking about it and saying, hey, I need help, or whatever the issues that they're dealing with, they're going to seek it. Whether they need medication or they just need to talk it out, or receive, direction on what's best for them in their home so they can better cope and take care of themselves. So thank you for what you do.
Yes, ma'am. Thank you.
All right, anybody else? No? Thank you for being here.
Yeah, thank you.
Thank you
Appreciate
for the
you.
honor
Yeah.
of being here.
Yeah.
Especially on short notice.
I know.
Yeah, we appreciate it.
Anytime I can talk about this, I'm there.
Always be ready.
All right.
So, council, once again, my apologies for being tardy. We probably have another, Shelby, 8 to 10? Chelsea, 8 to 10, probably, agencies that we will need to highlight in future strategic plans.
Okay.
So we still have some more.
All right, that pretty much takes us through our agenda today, other than, I think Councilwoman Coonrod, you wanted to bring up some legislation that you wanted to present to the council.
Thank you, Chair. In the inside of your folder, Ms. Nicole printed out a copy of the legislation. And it's just around, I'm sure you all aware that the state law is now in place to where around mass threats of violence. And it's particularly from the state level, just solely targeted around our schools. So just talking to Phil about what can we do or put in place to reduce the mass violence threats for our community centers, because they need to be protected as well. And there is a clause to where our city judge, so Judge Patty, that she can intervene in those spaces if acts of violence or anybody, is communicated, is text, or is verbally said in any kind of way on our city property, in our community centers, or anything like that. So this ordinance is just making sure that we're included in that, because we have kids, if they're at school saying we're gonna blow up the school, we're gonna kill somebody, they're coming to our community centers doing the exact thing, right? And we've already seen previously, before this law came into effect, is that, there were kids coming to our community centers with guns, there's been shootings at our community centers, and we need something in place that's gonna safeguard our community centers, our staff. A few people that I have talked to, the question came up to say, well, where would they go? If you put them out the community center, where would they go? Well, they're gonna have to be held accountable to their words of violence that could cause harms. We can't take it lightly, because we don't know if someone now saying those things, if they're playing or they're actually gonna act on it. Because what we've seen is people say that and they're acting on it eventually, and then we're coming around saying, oh, we should have had something in place. We don't need to continue to wait on the sideline, waiting on something to be in place. I've spoken with Mandy about this issue. I've spoken with Carol Hunter, who's now that's been hired to be in place. I've spoken with several of our school board members, our county commissioners, and I've communicated it to a couple of our city council members, as well as the mayor's administration. So I would like for you all to take a look at this, and Chair, if we can have a place in the legislative committee. I spoke with Ken about it, but he's not here at this time, about having it placed. And if there's anything you all want to add into, or you think should be removed, or any additional questions, I would love to have your support.
Okay. I will,
I do have a question.
yes, ma'am.
So Councilwoman Coonrod, so I, like you, have a child in Hamilton County Schools, and it's been interesting to see how the language of the state laws have impacted, the result of the law. And I know that the school board was looking at a resolution to request a tweak to the law. How does this ordinance align with what the school board is recommending to change? As I'm looking at a ban from attending further community center events with the opportunity to attend a hearing, and then a person who, somebody who knew something, but I'm just thinking about some of the statements that are coming out of the mouths of children have not been deemed to be substantial threats, and what latitude does this provide in that instance?
So I do know that I think Ben Connor had proposed some things to have a tweak, because he's saying, like, give the administrator of the school the discernment to say if this is something that they think that the kid would actually do or not. But for me, we can't take any threats serious because I could tell you I'm gonna shoot you up, shoot you down, kill you, and you would say, "Oh well, Councilwoman doesn't appear to be that way. She's not gonna do it." But then actually after school, I'm catching you coming off the school bus with my friends, and now we done gunned you down. Hence what we just recently saw. So I don't think that should be in our wheelhouse to decide which kid is actually gonna act upon that because we know favoritism can come into play with that. But the difference is that our ordinance would allow our city judge to make that decision. It gives that kid, that family member to go in front of the judge to say, to plead it out, or to say, you know, whatever it is, or the judge could recommend they go to counseling or therapy or whatever it is. But for me, we've had too many incidents of not taking it serious to the last minute, and then we're coming back reaping that mistake. So we got to be ahead of it.
Thank you.
It's a legal question.
Sure.
Can a kid go before a city judge, or does it have to be a juvenile judge?
There's a provision in the state law here for the juvenile to be able to go in front of the juvenile court judge for a violation on here. Any adult clearly could be going in front of the city court person, and a person who allows them in that regard would be going in front of the city court judge.
So, yeah, so I want us to be clear, I want us to be clear in the law. We're talking about an adult going before the city court, but a kid goes before the juvenile court.
Normally goes to juvenile court.
Just so we're clear of that.
And-
I think
and-
I like the basic idea, but what you want to do is you want to make sure it's clear
Yes.
in the language.
And the problem currently with the state law here is it applies to school property or school-related activities, and it defines schools as something other than your community centers. This gives y'all
And I
the
think the
authority.
councilwoman's correct. You can extend it to the community center.
Yes.
That's not where I am. If we're gonna do it, let's do it right. And I just wanna make sure the language is correct.
And we've got provisions, at least in it currently, that if it is a juvenile that is determined to be delinquent, that would be the determination by the juvenile court judge.
The juvenile court judge determines the delinquency.
Correct.
After they go before the juvenile court judge.
Yes.
They go as
Based upon the-
innocent, but to be heard before,
Correct.
okay.
Yeah, if there is a violation of either the state law or the city ordinance. Yes.
Any other questions? What's the purpose?
When did we get this? Was this sent out?
Yes, you sent it out today.
It's in your packet.
It came in our email today?
Just in our package.
It is in your
And the
packet.
packet, just the packet for today? Oh, okay. I was gonna say, if everybody else got it before I did, I didn't see it.
I got it at the same time you did.
Okay.
You know I don't roll like that. I'm not that kind of person.
I was just saying, I was just trying to make sure.
Okay.
So, may I ask
Yeah.
one more question? So, I'm looking at, item E on the second page about suspension of the juvenile's driving privileges or ability to obtain a driver's license. So what I'm seeing as just a citizen coming through the paper, I mean, we're seeing children as young as 6, 7, 5, I mean, in
In
age.
11, yeah.
Yeah, that are, I'm gonna kill you kind of statement then drives the entire process forward. I'd love to know your thoughts about how that impacts a child like this. So I guess in that regard, would it go to, just the ban? Is that what you're thinking? That a 6-year-old would just be banned for life from the facility? Is that, what's your thought?
And talking with Phil about it, is that what he's saying, that if they got banned or whatever it is, I guess the parent can go in front of the city judge. That's where the city judge come in to advocate for this kid. It may not be that they're banned for life. It could be, hey, we gonna suspend you from the center for 30 days or whatever that it may be, but it can be for the rest of their life, depending on the severity or if the act was actually committed.
And that statute right now is directly out of the state law, so that's what the state law says if it occurs in a school building right now.
And who bans them if it occurs in the school?
The
principal?
juvenile court judge at least would make the decision that they would not be able to have driving privileges for a year. And it's just additional teeth to at least try to get the person into not doing that.
So it's referral from the school, whoever's,
Right.
or referral from the community center to
to the
Wherever.
juvenile court judge, and then they make a determination, are they dependent? or-
Okay, but the determination isn't made at the community center?
No.
No, okay.
Yes.
It's fascinating that we live in a state that is so excited to make guns more and more available without permits and no training required, and now children aren't allowed to play gun. I mean, I'm not saying that they should be, but I just think it's we just have this logical disconnect happening between how we apply the Second Amendment in Tennessee and the realities in our schools and community centers. It's tough.
It's very tough, but when you have a constitution that says that you have the right to bear arms, I mean, that's a whole different thing. But Phil, if you don't mind, if you would distribute the state law so we can, everybody can
Give y'all
have a copy of
the
it.
state law as well. No problem.
Sounds good.
All right, that, I think does it. Chief, you got anything else? Okay, that does it for, as far as our agenda for strategic planning. We will have, a brief, according to our attorney-client privilege, so if the audience doesn't mind to give us the room.
Man, do you have any